Hello everyone, ladies and gentlemen, this is Dr. Sakamoto. Today, I'd like to talk about osteonecrosis of the medial femoral condyle, which is surprisingly common in people in their 50s. For symptoms of osteonecrosis, patients often experience a sudden onset of knee pain while walking or performing certain movements, such as climbing stairs. The pain from osteonecrosis can feel like a sharp needle-like sensation inside the joint, and it often appears suddenly without any apparent cause. Osteoarthritis of the knee also typically causes pain on the inner side of the knee during walking. The distinct characteristic of osteonecrosis pain, as I mentioned earlier, is that needle-like sensation. That is the distinct difference between osteoarthritis and osteonecrosis pain. This is a notable X-ray finding. When examining the knee joint, you can observe a slightly dark streak on the femoral side. This streak is subtle but noticeable, especially when you focus on the joint area. The femoral side is where this streak is most apparent, highlighting its presence clearly. This is the area of osteonecrosis. Common treatments involve various necessary injections, rehabilitation, and appropriate rest, such as needed, until the pain subsides. However, when the pain persists, artificial joint replacement is often considered. Even with such small areas of osteonecrosis, artificial joint replacement might be necessary, highlighting how troublesome this condition can be. Now, let's take a moment to introduce a case of stem cell therapy for osteonecrosis that was performed at our clinic. This patient is a man in his 60s. He enjoys running and had been jogging regularly. One day while jogging, he experienced a sharp stabbing pain on the inside of his knee. Initially, at first, X-rays indicated no abnormalities. However, as his condition didn't improve with treatment, he took another X-ray about 6 months later. This revealed osteonecrosis, as you can see shown here. In cases of osteonecrosis, hyaluronic acid injections often fail to alleviate the pain. It's likely that microfractures occurred during jogging, leading to poor blood flow and ultimately causing osteonecrosis. If hyaluronic acid injections don't relieve your pain, or if you experience a sharp stabbing pain, you might want to consider the possibility of osteonecrosis. This is a different MRI finding. You can clearly see a white shadow. This indicates osteonecrosis with bone damage. This patient experienced a 50% reduction in pain approximately 2 months after receiving stem cell therapy. And about 3 months later, the pain had almost completely disappeared. His pain level, which was initially a 10, is now consistently a 1 or 2. Approximately 6 months after the stem cell injection, we'll compare the MRI before and after the procedure and the results carefully to ensure accuracy in the treatment. As you can clearly see, the area where the crack was now successfully repaired. Let's take a look at the X-ray. The dark areas have almost completely disappeared, and you can see that the bone has healed almost completely. Osteonecrosis of the knee joint has been a difficult condition to treat with traditional methods. However, with the power of stem cell therapy, we're now able to address it. By offering stem cell treatment for osteonecrosis, we can potentially help many people avoid artificial joint replacement. Of course, treatment results can vary from person to person. Today we talked about osteonecrosis of the knee joint, which is more common than you might think. Thank you for watching the video.